Hi everyone, I am Dr. Raghavendra Ramanujulu, Lead Consultant, Department of Pain and Palliative Medicine Rehabilitation Services, Aster CMI Hospital, Bangalore. The topic we are going to actually discuss about is Platelet-Rich Plasma, or commonly referred to as PRP in chronic pain services. Where does this fit? Now, PRP is a form of regenerative medicine. In my earlier video, I've already mentioned about prolotherapy, which is another form of regenerative medicine treatment per se for chronic pain. Now, PRP, what does it mean? So, from a person or a patient who's actually been diagnosed of a condition, commonly like knee osteoarthritis, it could be joint concerns, could be back or neck, or any of the other concerns, could be others like shoulder, elbow, or sports injuries, or post-spine injuries, wherein patient has got severe concerns which is related to the pain which is not being better with all forms of conservative management and surgery is not indicated over here. Then we actually collect the blood from the patient, put it through a processing, and there is something called as the platelet layer, which is actually separated and removed out. This platelet is then activated by a mechanism and then injected back specifically where the concerns are. So this is injected around the tissue where the injury is there. It could be muscle, tendons, or ligament injuries or tears which needs repair. Now, why does this repair? The PRP, once it's injected, has got its own growth factors. These growth factors will start repairing them. So it tells the body to repair, the inflammation to settle down to a certain extent after 1 or 2 days. Now, once this is done, the repair becomes much better, and you actually try to rehabilitate the physiotherapy, occupational therapy, and others, which is important for that individual patient, for that individual condition, is something which was taken care of. Is this going to be a lot of concerns or disadvantages in PRP? Not much, because it can be injected many more times in comparison to a steroid injection, which could be 6 months to a year once you can do over here. But PRP requires multiple sessions and it should be targeted specifically. At Aster CMI, we have an interdisciplinary team which has got its own ultrasound machine for MSK ultrasound within the Department of Pain and Palliation, as well as we have the physiotherapist, occupational therapist, and other rehabilitative services under one roof. So please visit us at Aster CMI to get the right kind of diagnosis and the right kind of approach for your regenerative therapy for chronic pain concerns. Thank you.